Well, by asking the impossible, you get the best possible. Hello and welcome all of you to yet another episode of Face to Face. And today the medical studio camera crew is at the premises of Elliot Medical Center. And I am in conversation with Dr. ABBAS. He is a skin specialist and also a laser therapist. Hello and welcome to the show, Doctor.
Thank you so much. I'm very happy to have you here in Elliot Medical Center.
Doctor, tell us something about yourself.
I'm Dr. ABBAS Ashrafzadeh. I'm board certified in aesthetic medicine from US with 15 years experience in aesthetic medicine, anti-aging therapy, and laser therapy.
Okay, tell us something about the clinic as a whole.
With the respect, the Elliot Medical Center is based on Dubai. At least 4 to 5 years experience here in Dubai. We have a very good reputation in the city and people knows this place very well. And we are doing all the services in the field of cosmetology, aesthetic and plastic surgery as well.
Well, skin is considered as one of the largest organs. In fact, it is the largest organ of the body and you have to protect it by all means. Mm-hmm. What are the prerequisites or the precautions that one should take to protect your skin?
Actually, it's a very nice question you ask me. The most important things for the protection of the skin, or let's say that the most risk factor can damage the skin is the sun. Okay. So we have to avoid from damage by sun.
Mm-hmm. Well, doctor, there is a confusion in the market with regard to use of sunscreen lotions. Mm-hmm. So what is the confusion is that some people say or they're not aware about the SPF which is printed on the tag of the sunscreen lotion. So we would like to clarify that. It is 10, 20, 30, 70, 80. So what do we use?
Actually, the best SPF which we have to use for the protection of the skin in front of the UV of the sun is 30 or less.
30 or less?
30 or less. Actually, we don't need more than 30, SPF 30, because the maximum wavelength which is radiating to the skin by the sun will absorb by the SPF 28, mm-hmm. 20 to 28. So in this case, there is no need to use SPF more than 30. Even SPF more than 30 can irritate the skin mm-hmm. in front of the sun exposure. So we don't like to use more than SPF 30.
So it is advisable to use 30 SPF when it's tagged on the bottle?
Exactly, yeah.
What exactly is the definition of SPF?
Actually, the SPF is let's say the amount or the volume of the protection material which is inside the cream that we are using. I mean, a very simple word I'm saying that.
Simple terms.
Yeah, it means that it will give you the volume of protection of the skin in front of the UV.
Mm-hmm. Could you comment on anti-aging and treatments available in modern world?
Can I tell you one thing more about the SPF, if you don't mind?
Please.
About the sunblock cream, I mean that the very important points to use the sunblock cream is that we have to use the sunblock cream half an hour before going out from the home. Okay. If we will use it right on the time and we will go right after that, for first half an hour the sun can damage the skin. Okay. We apply the SPF, but it cannot help the skin. So this is a very important point. And the other point is that every 2 hours we have to renew the sunblock on the skin. Okay. These 2 points, usually most of the people, they are not aware of these 2 points.
Yeah, so please note that whenever you're using a sunblock lotion, apply it half an hour before you go out and every 2 years you have to refurbish it.
Exactly.
Talking now to the point about anti-aging. What is your take on that with regard to modern treatments and so on?
Yeah. Actually, one of the most topics nowadays in aesthetic medicine is anti-aging therapy, medicines, procedure, which we are doing nowadays. And a lot of people, a lot of ladies, they like to prevent of aging. So if we can do the prevention of aging by anti-aging medicine, so it means that we prevent from something which is going to happen to us later on. So it can help us a lot. We have a lot of advice, like how to change the lifestyle, how to have a healthy diet, how to sleep, how to walk, how to eat. These are all can help to prevent of aging, which can including the anti-aging medicine, plus the tablets, capsule, and procedure which we are doing inside the clinic. I mean that the anti-aging process is in two parts. One, which is depend to the person at home, lifestyle, and so on, which I told you. And the other part, we are doing in the clinic. We have a lot of medicine, therapy, lasers, injections, which can help a lot to prevent of aging.
And how long should one sleep, according to you?
Okay. Actually, the 8 hours is the best timing for the sleep in 24 hours a day. So less than 8 hours per day can damage a lot in the skin and can improve the aging.
That's the point. It will improve your aging.
It is, especially late sleeping can improve the aging too much.
So you have to at least sleep. But in this part of the world, in UAE, who sleeps for 8 hours?
Yeah, yeah, but mostly we have to follow
the basics of sleeping for 8 hours.
Exactly.
Tell us something about laser treatments. Is it harmful, or there is a myth in the market that about the laser treatment? So if you could clear it.
Yeah, actually, about the laser, since the invention of the laser till now, it passed about 65 years.
65 years.
Yeah. So the first laser machine they made it in 1960, if I were right. Since that time till now, the laser machines improved, and they progressed all the things about the laser. They tried, they studied a lot. But nowadays, especially since last 15 years till now, all the lasers are laser machine, and the laser technology is based on the nature of the skin and the hair. So there is no any side effect or complication, let's say complication, or any problem with the lasers. For sure, the laser therapy, like the other therapy, maybe we will have some side effects, like if we don't know how to use the proper energy for doing the laser, maybe we will have a bit burning on the skin. But this is the maximum harm that we can do on the skin. There is no any other harmful. Nowadays, the laser, let's say laser for hair removal, the wavelength which can affect on the hair follicle, now is clarified exactly that which wavelengths we need to remove the hair from the skin. And the target of the skin is the color in the hair. So it will not harm, or it will not affect to the other part of the skin.
And how expensive are the treatments, both the laser and anti-aging? Can you please touch both?
If you wanted to say about the cost, it's a normal cost. It's not that much it's like extreme cost.
Affordable.
Yeah, it's affordable. According to, for example, let's say that if you want to do a full body hair removal laser, like about 2,000 dirham, which is a normal and affordable cost.
And how about facials? There are so many beauty parlors in this part of the world.
Yeah.
So what is your take on facials?
Actually, in field of aesthetic and dermatology, we are not believe that much to the facial, which is going to do in the salons, and with the respect for all the salons, because they just spend some courses for how to do the facial, but they are not aware of the skin structure, what kind of harm they will cause in the skin, and how if there is any side effect happening, how they will treat it. And most of them, when they are doing something wrong with the skin, they are referring the people to our clinics. So I believe that even though if somebody wants to do the facial, it's better to be under the observation by a doctor, dermatology specialist, like aesthetic or dermatology, to avoid from any side effect on the skin.
How often should you do a facial, especially in a clinic?
In a clinic,
the frequency, what I meant.
It depends to the skin type, actually. In some skin type, we can do it every 2 weeks. In some skin type, we can do it every 1 month. 2 months. It depends exactly how is the skin type and skin quality.
What is your take on skin whitening? You know, the treatments available, you know, in different corners of the world, people are misled with the so-called skin whitening, be it creams or, you know, be it other modalities in the field of skin whitening. So what is your take on skin whitening and the treatments available? And we've also heard that there are injections available for skin whitening, so that if you could clear.
Actually, skin whitening is a general term.
Sometimes it's also referred as skin lightening. Skin whitening and skin lightening.
We can, if you want to classify it in two categories, we can say that skin whitening can be doing for somebody who they have some pigmentation on their skin, some localized pigmentation on the skin, which this one is the main purpose of the skin whitening or the skin lightening, which is approved, and there are some academic approach for that. The other category is that somebody who they have skin type 5 or 4 and 5, for example, like you, for example, and they are coming and asking about generalized skin whitening. For the first category, we have a lot of treatment. We have some kind of injection, local or even though IV therapy. Okay, we can do it. There are chemical peeling, peeling by the laser, which we can see a good improvement in the treatment of pigmentation, localized pigmentation in the skin. But for the second category, usually we are not advising the people to do the whole body skin whitening, because this is the nature of the body, and we don't like to change the nature of the body for the people. So, but if somebody requests that,
insists,
we can do it by IV therapy, which is helpful a lot.
How do you, can you tell us more about it?
Yeah, this kind of treatment has a 3-month course of treatment. That weekly they have to come and they have to take this injection. We will do, first we will do a test by the injection to see if there is any allergy to this medicine or not. And if there is no allergy, they are coming here, and every week we are injecting 1 IV injection therapy. In the first 3 months of treatment, we expected to see something around 20 to 25% of the result. But if not, we have to continue till we will reach to the optimum result or to the result that the patient is considering for it.
What sort of injections are those? Are they toxic or?
No, it's a kind of antitoxin, exactly. We call it glutathione, which this medicine first, they made it for, let's say, cleaning the liver.
Okay.
The people who they have a lot of toxin in their body or fatty liver, this medicine started to use for the treatment of the fatty liver and toxin in the body. And after that, they saw that with the use of this medicine, the skin is getting more white. So that's why nowadays we are using this one for the whitening.
Can it be treated orally or it is injected?
At the moment we don't have orally, it's not approved orally, but by the injection or IV therapy, I mean the systematic injection or local injection.
Is it a painful process or?
IV therapy, no, there is no pain at all. And local therapy, it's like a very small thing. It's not that much painful, no.
What are the different types of peels available, doctor?
Again, it's a very general terms. We have 2 kinds of peel. We can do the peeling by the laser, or we can do peeling by the chemical peeling.
Which one do you think is?
Again, it's depend to the type of the skin and which purpose we want to do the laser for them. For example, if there is hyperpigmentation, melasma, or any pigmentation after the sun damage and these things, we can use both of laser and chemical peeling, but with the laser, in our experience, we saw that the result is much better.
Laser?
Yes.
And how often do they have to come?
Every 2 months.
Every 2 months?
Yeah.
And is it expensive?
It depends to the area. Let's say, for example, for a full face, if you want to do, it's affordable, about 1,500.
Can you tell us or share an experience of a lifetime which you had in your term of practice? Any one experience, without mentioning the name of the patient, which you'd like to share in terms of your treatment?
I would like to say this one to our friends, or mostly I'm telling this one to my clients as well, that in aesthetic medicine or in cosmetic, the people, they have some consideration or some concept for the beauty. They will, their idealistic thinking they have. They think that if they will come to my clinic, when they are going out, they are somebody else, or they can reach to, for example, face like here, especially in this country, they will call it Nefertiti face, for example.
An actress or actor?
Yes, like celebrity and stars. But most of the time, there is difference between the concept that people they have from the beauty and the reality that we can do for them. So the thing which I wanted to say is that people should, they think that's okay, normal, no problem. But they have to believe to their doctors that what their doctors saying them, that if we can match the reality that we can do for the patients and the concept that they have in their mind. You got my point? So there is different, most of the time there is different between the patient's concept of beauty and the reality that doctors can do for the patients. So I just please from our friends to know that this is very important to match these two. Sometimes we can, but sometimes we can't.
How do you frequently update yourself in terms of innovation, technology, and so on?
Very good question. Actually, nowadays, in aesthetic medicine and dermatology, like other field of medicine, we have to be updated with the old technology, latest technology, which is coming and innovated. Usually, we are attending to the old conferences, workshops, which is taking place all around the world. For example, in Europe, in US, here in Dubai, we have a lot of conferences and workshops about the new technology and new procedure which we can do. So usually I'm attending all this one, and with the study of the references, books and papers which is published in the internet. And mostly we are updating ourselves like this.
So where do you see yourself 5 years from now?
The big differences since 5 years till now, because as the technology improved, we have to improve ourselves. So when you improve yourself, you can feel much better than before, with more experience, more knowledge about the treatments, about the aesthetic, and about the concept of the beauty.
And the summer is on its peak, it's on its way. So what have you got to tell the audience in terms of precautions for summer whenever it comes to skincare?
My advice to our friends is that first of all, in this climate, they have to drink a lot of water.
What is the prescribed limit of water you should drink?
At least we can say 2 big bottles, like 8 glasses of water.
8 glasses of water.
Yeah, that is water. I said water. I didn't say juice. I didn't say Pepsi, Coke, or the other one. Water, tea. These are all separate.
Water.
8 glasses of water, pure water, they have to drink, and sun protection by the sunscreen creams.
What are the consequences of the so-called water consumption if it's not adequate? Let's say a person drinks only 2 glasses or 3 glasses instead of 8 glasses on skin.
The skin can be dehydrated, which it means that we can see the manifestation of dehydration on the face, like open pores on the cheeks, on the skin of the forehead, and we can see the increasing in laxity of the skin. The skin will have a lot of laxity. And even though the PIH will happening, which we call it post-inflammatory hyperpigmentation, means that when there is no enough water in the skin and its skin is dehydrated, it is very prone to take any damage from the sun. So we will see some brown points on the skin and open pores.
So it's ideal to have 8 glasses of water.
Exactly.
whenever it comes to skincare.
Mhm.
Well, the world is facing a so-called hair loss.
Mhm.
But I'm the right person, not
Oh
the
yeah,
wrong
you
person
are
to
the
talk
right
about
person.
that. But nevertheless, doctor, give us a few information
Okay.
on hair implant. Is it the right word?
Hair implant, yeah. Actually, everybody knows nowadays about the hair transplant, which is a traditional way which we are doing hair transplant for the people. But in some rare cases, some of the men's or even women's, they don't have enough donor area for hair transplant in their backside of the head. They don't have enough follicle of the hair, or general, we can say, donor area. For such these people, there is a new technology for hair implant. It means that there is a ready-made hair, which is exactly according to the shape and quality of the normal hair. That these hairs are ready, and just we are implanting in the place that we lost the hair. This technology has some good advantages and some not good advantages, let's say that. For example, this kind of hair cannot grow. The size is fixed, and we have the fixed sizes on the hair. But for the people who they don't have enough donor area, and there is no other way to have hair on the head, so this method is wonderful. We call it biofiber.
What is it made of the hair?
It's a kind of polyamide. Polyamide is the same quality. The suture which we are using, the absorbable suture which we are using, or some kind of unabsorbable suture, is the same quality, but they changed the formula and they made it very, very close to the natural hair.
Is it painful for the hair?
We will use the local anesthesia for doing, and we are using the a special machine, automatic machine, for implanting the hair inside the skin.
So how long does it take to cure once you implant?
Once you are implant, done.
That's it?
That's it, yeah. And right after the procedure, you have hair on your head.
So after the implant, does the patient have to come frequently to the clinic?
Yes, first 2 months, there is need to come every 2 weeks frequently. We will see them, we will check the skin in order to prevent of infection or rejection of the implantation.
Medication is required after the implant?
No, there is only 5 days antibiotic therapy. They have to use it, and after that it's finished. It's a very simple and easy method to do.
How famous is this technology at the moment in this part of the world?
Actually, in this part of the world, it's not that much famous, but in Europe and US, it's famous.
And how about the cost factor?
The cost is because it's a high technology method. The cost is a little bit high. We can say that the cost of each hair for implantation is about $1.5 US.
And it depends upon the area which the patient.
Yes, it depends that how many hair we will use for implantation. The technology is really, really wonderful for the people who they don't have enough donor area.
So how do you, share space between your professional and your personal life? You're a busy man, so.
Yeah, actually, it's difficult. It's difficult to do, but we have to arrange it.
You're on the call.
I'm always on the call. I'm always attending to the conferences, seminars, traveling. So it's difficult.
So does your family complain?
Sometimes, yeah.
Thank you, Doctor.
Thank you so much. Nice
Wonderful
to have you
moment
here.
speaking to you.
Thank you.
And lots of information shared, and maybe people who would like to visit you, and your website and other details will be given on the show. And the next time I come and see you, I wish you and look forward to see you in a very high position.
Thank you.
In a better position.
Thank you. Nice to have you here.